Dr. Grant here, going to go over a release for the gluteus medius. It's one that's going to create a lot of havoc for a lot of people. So gluteus medius is a muscle that goes, you have the bone here, you have the waist here, right? You got the pelvis that kind of wraps around, and it's going to go to your tailbone, right? So anywhere in between where that bone is and your tailbone and this bone, and really where your pocket is all fair game to work with the lacrosse ball to get some relief, to help improve hip rotation, to help improve lower back pain symptoms for a lot of people, especially one-sided kind of issues that are catching, grabbing, aching, just terrible kind of feeling. One piece of the glute med is going to be in the very front. You could think I'm laying here, I've got this bone, I'll just roll just behind it, literally just behind it, not any further back, just right behind. I'm gonna roll over, and there we are. It's gonna be pretty intense for a lot of people. Me, not so much right now, don't know why. There it is. So you can kind of shift your pressure, turn your body to vary which of the trigger points you're kind of hitting here. And so that's one of them, right? There's a lot of them for a lot of people. But normal healthy tissue should just feel like pressure. If it doesn't feel like just pressure, something that we can work. Now, granted, this is temporary, this relief, but over time it will get better as long as we're implementing the proper mobility and activation, strengthening exercises for you and your specific needs. We're gonna take this ball, kind of work our way. So that's bone. I'm gonna come just below those kind of higher fibers, if you will, of the glute med. I'm gonna kind of pin it. I'm gonna rotate it a little bit into it. And I'm gonna drop this leg open, close, open, close. I'm gonna kind of vary my pressure and the angle of pelvis, but also I can vary the angle of my torso. So right here is pretty tender. If I rotate, it's gonna be a little bit different, a little more intense for me, rotating this leg up and down. Or you could just hold it, hang out. This is the easy version, if you will. But having that movement is helpful. And we're gonna move that ball around a little bit further back towards the tailbone, working in that region as well. So I'm kind of rolling my pelvis back side to side. I'm gonna kind of turn my torso. I'm gonna lift and open and close the leg. And you're gonna find a lot of different points along this area, okay? Spend about 20 to 30 seconds on each individual point if you want to, but I would suggest kind of search around first, find ones that are really tender, that aren't too tender. If it's too tender, start with maybe a tennis ball, and then work on that first. Spend 20 to 30 seconds, or if it's starting to release and you need a little bit longer, spend that time there. Don't bruise yourself. But it will get better, and you're gonna stand up and you're gonna feel like this is actually a lot looser, or it feels better, at least a little bit. That's the goal. If it's not, you might not be doing it right, or it might not be the right thing for you. And if I'm working with you, definitely let me know if you're struggling with finding these spots, because it can be very, very game-changing with how you feel, how you move. Make sure you follow this up with strengthening and mobility exercises that are appropriate for you.